Well, good afternoon. We're in the fight of our lives right now, and our enemy is ruthless. It preys on our seniors and the most vulnerable. And the reality is, despite our best efforts, we're dealing with a wildfire at our long-term care homes right now. This is extremely difficult on people and families. Families are separated from their loved ones right now, and people are dying. My heart breaks for those who have lost their loved ones in long-term care homes. My friends, the sad truth is our long-term care homes are quickly turning into the front line of the fight against this virus. And my top priority right now is getting the troops and the resources needed to this front. We're going through everything we have at our long-term care homes, and tomorrow we will launch an enhanced action plan to fight COVID-19 in long-term care homes. Our plan will include more support and more resources. We'll spare no expense to protect our most vulnerable. We must redeploy every available resources to our long-term care homes right now. It is absolutely critical. And thanks to our collective efforts, we've not seen the surge in our hospitals that we were so worried about. As a result, we have capacity within the health sector. And I want available resources from our health system to be redeployed to those homes when there is a serious outbreak. We need to get hospital-based care teams to help long-term care staff manage these outbreaks. And I want to see specialized teams deployed into long-term care homes when there's a serious outbreak. This is something that our officials are working on right now. And tonight, we'll issue a new emergency order that will ensure every employee in these long-term care homes can only work in one home. I want to thank the sector for helping us get to this point. Issuing this order today is only possible because we now have the staffing resources we need in place. That is why we allocated $243 million to help homes and staffing, testing, and operational needs. We are immediately directing funding to cover much needed additional staffing. There'll be more staff for the homes that need it most, and cover the cost of increasing hours for part-time staff. And we're prepared to spend more as required. We're also moving rapidly to enhance COVID-19 testing within the sector. This is a top priority. New infection control measures are being put in place immediately for all high-risk homes. Infection control specialists are going into the homes as we speak to enhance protocols to ensure the homes are prepared, to make sure everything possible is being done to isolate patients and prevent the spread. We're responding to most requests for new PPE within 24 hours. My friends, this is just the beginning. As Premier, I will do whatever it takes. I will spare no expense. I will leave nothing on the table when it comes to protecting our seniors and the most vulnerable. And I will do everything necessary to get more resources to the front lines, to support the brave men and women working in our long-term care homes right now. And I want to thank, from the bottom of my heart, those hardworking men and women who show up every day, who work for hours on end to protect the health of our loved ones. Every registered and practical nurse, every personnel support worker, every member of the cooking and cleaning staff, every volunteer. Your sense of duty is the true meaning of the Ontario spirit. You are our heroes on the front lines. You are in the trenches of this war, and we cannot win this battle without you. I want you to know this government has your back. We're using every tool available to us. We're redeploying every resource we have. And to the families out there who have grandparents, parents, siblings, or children in these homes, I want you to know we are here and we hear you loud and clear. We will overturn every rock, every boulder, if that's what it takes to protect our most vulnerable. Thank you. God bless the people of Ontario.
We'll go to the phone line for questions. First question.
First question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Premier. I'm sure you're going to get a lot of questions about long-term care, but I just wanted to focus for the moment, though, on the issue of the testing going on in long-term care and some of the reports that we're having coming from public health units. So as part of this, are you going to mandate that everyone in long-term care is tested, as you've been saying you want to have happen? And is there going to be some sort of direction to the public health units to be transparent about deaths that are happening at long-term care? Because we're having a lot of public health units that are telling us that they will not say how many deaths are happening at specific long-term care homes because that information is confidential.
Well, I'll have to speak to him, Mike, about that. I know that we have 626 long-term care homes. 114 are infected right now. That's approximately 14%, and that's still too high, in my opinion. We have over 500 seniors homes, and there's 34 of those homes infected, about 5%. So. I will follow up on that question. The other question yesterday, Mike, regarding the robocall. We immediately talked to the long-term care home. They said it was an accident. They said it was inconsiderate and it will never happen again. So for those folks that received that robocall from this long-term care home, we apologize. Plus, the long-term care homes are 80% are private homes, and we're going to support them every way we can.
Okay, and if I could put a question to Minister Elliott on another topic, which is about medications available for keeping patients on ventilators. I understand from a few of the medical people that I've spoken to in hospitals that there are concerns about the supply of sedatives and what are called paralytics to basically allow for patients to be put on ventilators. What is the province doing about this supply, and how concerned should we be about the limits on the supply of these drugs?
Well, we have been concerned about the supply of a number of drugs available on the market. That is one of the reasons why we put the 30-day prescription refills in, so that there would be medications for everyone. For the specific medications required for patients on ventilators, we're constantly sourcing new drugs. We're looking for the new ingredients for them from other countries. We're working with India in particular right now, and of course we're working with the pharmaceutical companies as well. They are giving us ideas of the supplies that they have, what else they need to have, and we're prepared to go and negotiate with other countries as well to get the active ingredients that we need in order to make these medications, because we know that there is going to be demand for them. So we continue to work on that as well.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Hi, Premier. Thanks so much for taking my call. My first question is about your announcement, the order you're issuing tonight about long-term care home workers cannot work in more than one home. We know that across the province there had been a staff shortage, so suddenly why is there all these extra workers? I mean, are they coming from the health portal that was previously announced where, you know, workers can be matched with an employer? How are you confident that suddenly there's enough workers to meet the capacity in each of these 600 plus homes in the province?
Well, we're going to be reallocating resources. We haven't seen the surge that we thought would be in the hospital, but if you don't mind, I'm going to hand this over to the Minister of Health.
Well, we know that the order is going to be necessary, first of all, in order to make sure that there aren't any workers that are inadvertently carrying the virus from one location to another. This is really key to limiting the expansion of the virus in our long-term care homes. But we are also receiving, through the job matching application that was set up last week, thousands of applications from people who have been involved in healthcare, whether they're retired nurses, medical students, whether they're medical professionals from other countries, or other people who have the relevant care requirements. We have been matching a solid number of potential employees with long-term care homes. They've put in the most requests so far. So we can expand that workforce with these people coming in who have the skills and knowledge that we need in order to make sure that we can have our long-term care homes properly functioning with the right number of people.
Thank you, Minister. And Premier, I want to ask you about a potential extension to school closures. Today, you extended the province's emergency declaration until May the 12th. So, of course, just stating the obvious here, school's not going to open on May the 4th. I mean, at this point, that doesn't seem likely. When will you give parents, students, and teachers some certainty as to how long that extension will be in place in terms of the closure and, if school is going to extend potentially into the summer?
Yeah. Oh, good question, Christina. So school will not be going back on May the 4th, and the minister will be having, we'll be talking further on this in the next couple of days. But just to confirm, students will not be going back on May the 4th. That does not mean the year is canceled. Minister of Education will be out over the next couple of days.
Next question.
Next question comes from Travis Denrush of Global News. Please go ahead.
Hi there, Premier. The Prime Minister said this morning that he is willing to look at the possibility of providing provinces with funding to top up pay for long-term care workers and also for more hiring. Have these conversations happened with the federal government, and if so, what kind of timeline are we looking at in order for this to happen?
Yes, that conversation took place with the Prime Minister along with the Deputy Prime Minister, and we're reviewing that. I know Quebec has taken them up on that offer, but we'll review it. And maybe when it comes to the financial side, I'll pass it over to my Minister of Finance.
Thank you, Travis, for the question. So yes, there have been discussions led by the premiers and the Prime Minister about what needs to be done. Obviously, as we've discussed, there are going to be financial implications for workers if they're only able to work in one location. The other reality, and this was acknowledged by what Quebec did, was that the federal government's program that is paying $2,000 a month inadvertently put pressure on that sector where, particularly in the case of Quebec, many of those workers were making less than that. So we have been involved in those conversations. I've been in communication with Minister Morneau today about it, and we will obviously bring that forward. But the main point, and I think the Premier's made this, is we will make sure that the support's in place for those vital workers who are doing the work that needs to be done and staying at their posts in the long-term care homes.
And my next question is for Minister Elliott. Minister, Global News has obtained documents from Toronto Public Health and also a directive from Dr. David Williams that states staff in long-term care homes that test positive for COVID-19 may return to work if they are asymptomatic. Why are we allowing workers who may still be able to pass on the virus into facilities with the most vulnerable?
Well, we're still concerned about that. It's only recently that we found out that you can be asymptomatic but still be able to transmit the virus. So that is something that we're studying very carefully because we don't want any more long-term care residents to become infected with this. So we have to be particularly careful. That would be something that I would be very concerned about as a province-wide strategy.
Next question.
Next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hi, Premier.
Hi,
this is about, long-term care workers and PPEs. I'm hearing that they're still not all getting PPEs. And these are the people that are in very close contact with residents. We know it's spreading like wildfire. As you said, they're bathing them, they're changing them. Why aren't all staff in long-term care homes getting PPEs?
Well, I can tell you the report I got back was within 24 hours, and especially more local ones. Now, One's a little further distance. I think it took an extra day. But every single PPE item that we have within 24 hours of a phone call, we have it over there. If you have the home's name, you can contact me later, and I'll follow up on it, because there's been very, very strict instructions that they get the PPE that they need. And I've followed up on it, and they told me within 24 hours they have this PPE over there. So I'd really like to know. I'd like to follow up on the homes.
Okay.
Or home.
And going forward, do you think that this is a change that should be permanent, that long-term care workers can only work in one home and be paid a salary so they can survive on that instead of working part-time hours in multiple homes?
This is just a personal view, and I have to rely on our chief medical officer and our health team. Personally, yes. My heart breaks for these people. They deserve every penny, 10 times more than that as well. But again, that's my personal opinion. I will take the advice from our chief medical officer and the team and long-term care as well.
Next question.
Next question comes from Randy Rath at CHCH-TV. Please go ahead.
Hi, Premier. Hi. I have a question about long-term care facilities. We're doing a story today on Anson Place in Hagersville. They have 50 cases, 15 deaths. Again, the workers there say that there is a severe shortage of PPE. And also the families of people that are in there are wondering why their loved ones aren't being transferred to hospitals where they think they could be more properly treated.
Well, first of all, my heart breaks for the people that lost loved ones. I will follow up to make sure that they have the PPE that they require. And regarding the transfer, I'll pass it over to the Minister of Health.
Well, certainly if people need to be in hospital because of COVID-19, they will be transferred there. But in some cases, I recognize that for some smaller homes where there are 4 people to a room, it's really difficult to self-isolate someone with even a mild case of COVID-19 from the other residents. So it may be necessary to transfer that person to hospital where they can be self-isolating, and that's for their own protection and for the protection of all of the other residents as well. It really does depend on the home itself, on the geographic location to hospital, but rest assured, if people need to be in hospital because of COVID-19 for a long-term care home, they will be taken to hospital.
Okay, my next question, I'm wondering about the finances of municipalities. The societal lockdown has deprived cities of a lot of revenue streams. Hamilton is predicting a $22 million loss in revenues by the end of May. Municipalities can't run deficits. Is that going to change, and is the province going to bail the cities out?
Well, I've heard that not only about Hamilton, but I heard it about Toronto. Just on the TTC alone, they're losing tens of millions of dollars every single day. But again, when it comes to finances, I'm going to hand it over to my Minister of Finance.
Randy, thank you for the question. Steve Clark, our Minister of Municipal Affairs, has been in touch with municipalities. Obviously, we are all working our way through this, and some of the services that they continue to provide, like transit, for example, are very important for many reasons, but including making sure that our vital frontline workers can get to work. So we will be working with municipalities as we have already. We transferred about $250 million to them directly as part of our initial program, and we'll continue to have those conversations, continue to work with communities around the implications, both in this phase of addressing the crisis and also as we look at the recovery.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Premier Ford, I'm wondering if you can say definitively if this will be the last extension of the declaration of the state of emergency for the province, and if not, what you might say to people who see this pass today and feel discouraged or frustrated by that.
Well, the number one priority, this is a health crisis, and I'm not going to jeopardize people's health to open up the floodgates. I'm just not going to do it until we start seeing the curve go down and it's absolutely essential that we continue on with the path that we're going. And I got to thank the people of the province of Ontario, the 14.5 million people that followed the protocol about self-isolating and social distancing. That's the reason we're in better shape. And I always say better, and it's nothing's great, but we're in much better shape at our hospitals and our acute care areas than we ever thought we'd be at right now. But all the thanks goes to the people, the residents of Ontario, that were able to stay self-isolated, and that's the reason we're doing fairly well on the hospital side. And I always describe it as, you know, we have some bushfires, but we have an inferno happening at long-term care, and we're going to put every single resource we can to make sure that we focus on the long-term care right now.
And Premier, on long-term care, the Registered Nurses Association of Ontario has been asking the province specifically to limit the number of homes nurses, healthcare workers can work in for weeks now. I'm wondering why it's taken so long to move on this, and is it too late to make a difference here?
I feel it's never too late. Now, keep in mind, over the last few weeks, we had to make sure our hospital's ready, acute care area was ready, and the infectious area of the hospital, that they had the resources now. I'm sorry, the infection control personnel, I should say, within the hospital. Right now, it looks pretty good in the hospitals, but again, we have to make sure that we have the resources before we made the move on this one item. We feel we have the resources to back it up and take the advice off our Chief Medical Officer, and that's why we decided to make a move now. It's critical that we get in there and help the people at long-term care.
Last question.
Last question comes from Siobhan Moore from News Talk 1010. Please go ahead.
Hi, Premier. This is really a takeoff on Sean's question. But I think not even over the last number of weeks, you've heard since the days post-SARS that, you know, this idea of people working in multiple homes was a real danger. So in the epicenter of the SARS outbreak, why did we not learn the lesson of that outbreak and apply it to this one?
That's a very, very good question. Right now, I'll tell you, we didn't have the staffing available to go to the 626 long-term care homes. And now we feel we can reallocate some staffing up there to support the long-term care. So, and we took the advice off our Chief Medical Officer to make the move now.
Okay, and just on another subject, do you see any need at this point to put buying limits on some grocery items? I'm thinking of beef in particular because of the shutdown of a plant in Alberta, and we've heard that that's going to limit the availability of beef in some grocery stores.
Yeah, well, again, that's going to be up to the retail folks. They measure the numbers. They know exactly how much they go through, and I haven't heard from them yet. And that's going to be strictly up to the people that run the retail chains. I know that we have one beef company, the last one in Toronto, St. Helens. They're working around the clock to make sure they supply as much as they can to the retail stores. Thank you. Thank you, everyone. Thank you.